Are there special like tools from a technology standpoint or skills from a staff standpoint that you need to run that managed lives business?
Yeah, without a doubt. I mean, so it's really all about, well, there's a couple things that come into this. Let's just break down a few. A big part of it is really understanding and risk stratifying your population. So that's a big thing. So data is king when you come into doing any sort of premium pay business or capitation or value-based care, whatever you want to call it. And the more that you understand your high-risk patients, and you can really wrap your arms around them quickly through different programs, if it's high-risk clinics, nurse navigation programs, really engaging pharmacists in helping people manage their medications. I mean, the list goes on, but the data really drives the ability for you to wrap your arms. Usually about 5 to 10% of your population is where, 80% of your spend comes from. So if you can get your arms around that population and sort of, help keep them from going to the ED, embracing more, hospital at home programs, or just giving them places to go where they don't have to go to the emergency room, if they're having something that's going on with them is a big thing of how you can get in front of it. So data is really, really crucial from that standpoint. And then the second thing I would say is, utilization is super important when you're looking at being in that type of business. And what you want is you want things that need to happen, and you want the care to be appropriate. And this is the sort of the I don't know, it's what a lot of healthcare systems need to figure out how to thread the needle here, where you have providers that are really providing the right care at the right place, and it has to be appropriate care. So you're not overdoing testing or, overdoing certain procedures, which we know from national numbers that about 20 to 30% of care that is provided is unnecessary. And so that's the space, I think, where you got to use a lot of data, get your providers together, looking at their data and starting to have conversations with one another. And that's been a big part of what we've done over the last probably 7 or 8 years.